Hi, today we're starting a new series about an incredibly important topic, menopause. Let me tell you, number one, there's nothing mini about it. It's a big deal. Every woman is eventually going to go through it if we live long enough. Number two, I really want to try to help erase the stigma around menopause. A lot of women are uncomfortable or ashamed talking about it, but it is something that our bodies are programmed to do. And so I'd really like us to start an open, honest conversation about these normal, natural changes that happen in every woman's life. Cringe warning, if you are squeamish talking about body parts, as my sweet husband Jason likes to call them, mysterious lady parts, then this next series may not be for you, but please, it's a normal human thing. Let's tackle it together. The average age of onset of menopause is around age 51. That can vary depending on your body, your genetics, etc. But we start looking for this in middle age. Many times hot flashes or other symptoms will start 3 to 4 years before we start seeing the periods spacing out. So every woman is different, but in your late 40s you can start to expect some of these. Every woman knows that our hormones fluctuate from the time we start to see female hormones emerge in late childhood, early adolescence, all the way through our childbearing years. But grab a hat and hang on, because menopause is legit.
In fact, I was too legit. I was too legit to quit.
We're going to delve into several different topics more deeply as we go through, but typical symptoms of menopause are hot flashes. You know what I'm talking about. Night sweats, insomnia, which sometimes is from hot flashes or night sweats, but also just hormone fluctuations. Some women will have joint aches and pains, breast tenderness. Many women experience what we call menopausal brain fog. Some women will even have menstrual migraines related to this. And of course, absence of periods. We consider someone fully menopausal when they haven't had a menstrual period for a year. So that calendar year is really what we're looking for. Side note, if you have been fully menopausal or haven't had a period for a full year and then have vaginal bleeding afterwards, you absolutely must contact your doctor, because that could be something serious. We never, ever ignore postmenopausal bleeding. Another hallmark of menopause is mood swings or depression. Funny story about myself, that's how I discovered that I was going through menopause cleverly. I had been waking up every night for a while, throwing the covers off, just hot as could be, thinking it was a mattress problem or a comforter problem, and then it finally dawned on me when I got irritated with my mother, who is a saint. She's an angel from heaven and everybody loves her, but I was grumbling around and thought, wait a second, look in the mirror. That's not mom, that's me. And then I started putting all the pieces together and thought, I'm only 49. This couldn't possibly be happening to me. I'm too young. Well, as it turns out, hit me at age 49. So not everybody's body reads the textbook. It may happen a little earlier than age 51. Some later on changes that can happen are vaginal dryness and ultimately atrophy of the tissues in the pelvic region, whether that's labia, vulva, clitoris, vagina, etc., and can lead to sexual dysfunction. There are also long-term consequences of estrogen deficiency, and so we certainly want to address these. One is cardiovascular disease. Women don't have as much incidence of heart attacks and strokes when they're younger, but after going through menopause, we catch up with the men. Bone mineral density loss or osteoporosis, we certainly see those. Thinning of the skin and, it's funny, decrease in cognitive function. Thanks to my notes for that. Menopause brain. So we see a rise in dementia after women go through menopause as well. Correlation does not necessarily equal causation. One of the main things that my patients consult me about when they're going through menopause is their change in body composition. We tend to form more fat mass and lose some of our lean muscular body mass. And Any good American woman is horribly concerned about her physique and has probably spent a great deal of time and effort during her entire life trying to maintain that girlish figure. And when we hit menopause, our bodies really start to work against us. The way that I look at this is not that it's a welcome change, but that I feel like our bodies know that we're going to start losing bone density. So as we lose bone density, our bodies tend to want to have more insulation around the areas, the hips, thighs, lumbar spine, where we tend to gain that weight in the midsection to help protect our bones should we fall. For some women, it is more difficult to ascertain when they may be going through menopause. Myself, I've had an IUD since my youngest son was born and he's 13, so I haven't had a period since the year 2011. Women who have had endometrial ablation or have had a hysterectomy that spared their ovaries, they have still had normal fluctuations of hormones until they start going through this. So we have to use other signs from your body that things are going on. So we look at the hot flashes and the mood swings and the night sweats to see if that's an indication that you are in menopause. We usually don't require a big laboratory workup for this. It's most often a clinical diagnosis. So if you're talking to your doctor and you decide to do some lab work to check your hormones, if you're still having regular periods, your hormones are probably normal. I have women ask me to check their hormones all the time. If you think you might be going through menopause and you haven't had periods or they've been spacing out or acting strange, then usually the number that your doctor is going to want to check is the FSH, or the follicle stimulating hormone. And if it is significantly elevated, then that's a good indicator that you are at least in perimenopause, if not fully menopausal. What if you have been on birth control pills for years and years? Most doctors consider, in the right circumstances, that it's pretty safe to help women avoid pregnancy, but also to control hormone fluctuations up until age 50 or 51. If you want to get off of those and determine if you're menopausal, you'll know within 4 to 6 weeks usually if you are going to start having hot flashes, etc. Most women would have great difficulty conceiving at age 50 or 51, so most doctors find that this is a pretty safe time to test this, especially if you really want to know if you're a candidate for hormone replacement, etc. But don't stop any of your medicines without talking to your doctor first. So, as we venture into this grand adventure, I would tell you all, grab a hat, hang on, expect the unexpected, and stay tuned. We're going to delve into hot flashes next. Don't forget to like and subscribe.